welcome to another edition of NHIS in a Week. In the headlines, NHI kicks off nationwide training of health providers under World Bank program. And World Bank Group builds capacity of Tier 3 NHI's credentialed health providers. Now the details. The National Health Insurance Authority has commenced training of Tier 3 healthcare providers across the country. These cohorts of providers comprise CHIPS compounds, health centers, and maternity homes, who together form the majority of healthcare facilities credentialed to serve the National Health Insurance Scheme members at the primary healthcare level.
So, on behalf of the NHIE and CPC Tamale, that is responsible for the 5 northern regions, northern, northeast, upper west, and Savannah regions, I have the privilege to once again welcome all of us to this very important engagement this morning. The main purpose for this gathering is to roll out a nationwide capacity building for our Tier 3 providers, that is the CHIPS compound, the health centers, and the maternity home.
Some people stand on it, we can hide behind it. So observe it. So my fellow directors and colleagues from the NHI, and then also the district health directors, and most important of all, the providers, the maternity homes, the health centers, and the CHIPS compounds. We are glad to have all of you here. And we say welcome. And thank you very much for taking time out of your busy schedules. You should be in your facilities providing services, but today you are here to join us for a very noble cause. And we believe that by the time we end this program, it will be something that we all be appreciative of, that will improve the efficiency and effectiveness of our claims process from our facilities through the CPC, through operations, finance, and finally pay more. It is very, very important because what we are trying to achieve here is to ensure that what we call the primary healthcare providers receive their claims as soon as they submit it to the National Health Insurance Authority. And what I mean by the National Health Insurance Authority is that when you submit it to the CPCs and then you receive it, you should take the minimum time possible for you to be able to get your money so that you'll be able to operate and then provide services to our subscribers.
The World Bank, in partnership with the National Health Insurance Authority, trained about 70 Tier 3 providers on expedited claims generation and submission from the Northeast region.
Sometimes we do an update. So at the facility, ideally, this one, it will not cost you anything. Ideally, you do an update before you submit your claims. I would advise, so that if there are any updates, it will affect your claims before you submit. Coming back to the submission system, I made mention online and offline submission. The very first one, the individual or the facility has access to internet. So immediately,
the Ashaman District Office has held its 3rd quarter stakeholder engagement session with members of the Christ Apostolic Church, Jericho Branch, on Tuesday, 12 September 2023, under the theme My NHIS App. Members were taken through the process of using the My NHIS App and were encouraged to register for the Ghana card as a requirement to be able to use the app to renew their membership or enroll as a fresh registrant. The team took the participants through the process of mobile renewal on the phone and linking of the Ghana cards to the NHIS card. The Medina District Scheme organized its 3rd quarter stakeholder engagement session in collaboration with the Assembly Member for La Nkwantanan West Electoral Area of Lanma, Mr. Abraham Ni Udai. This event coincided with the Homowo festive celebration organized by the Assembly Member and provided an opportunity for officials from the Medina district of the NHIA to educate the public about the newly established co-payment committee and its role in the healthcare delivery in Ghana. Still in the news, the Research Policy, Monitoring and Evaluation Directorate of the NHIA has embarked on a 2-day trainer of trainers dissemination workshop for selected staff from respective directorates at the head office. Next is Health Tip. This week on Health Tip, we take a look at the science of mental health. Now, this is how we wrap up this week's edition of NHIS in a Week. For more stories, do log on to our website www.nhis.gov.gh and follow us on all our social media platforms displayed on the screen. My name is Jane Trematin. Thanks for watching.